19. Tabber's Cyclopedic Medical Dictionary. Page 1730. Pregnancy. The condition of having a developing embryo or fetus in the body after successful conception. The average duration of pregnancy is about 280 days. Estimation of the date on which delivery should occur is based on the first day of the last menstrual period. See Nalachali Rule, Table, Prenatal Care, Prenatal Diagnosis, Nursing Diagnosis Appendix. Demographics. About 7 million Americans become pregnant each year, and about 2/3 of these pregnancies result in live births. In 1998, there were 3.94 million live births in the U.S. Signs and symptoms. Presumptive and probable signs are those commonly associated with pregnancy but may be due to the other causes, such as oral contraceptive therapy. Presumptive symptoms include amenorrhea, nausea and vomiting, breast tenderness, urinary frequency, fatigue, cloasma, vaginal hyperemia, Chadwick sign, and quickening. Probable signs include increased abdominal girth, palpable fetal outline, softening of the lower uterine segment, Hager sign, softening of the cervix, Goodell sign, and immunodiagnostic pregnancy tests. Positive signs and symptoms of pregnancy are auscultation of fetal heart sounds, fetal movements felt by the examiner, and an identifiable embryonic outline on ultrasound. Physical changes. The pregnant woman experiences many physiological alterations related to the increased levels of estrogen and progesterone and to the demands of the growing fetus. Every system in the woman's body responds to these changes. Reproductive tract changes, alteration in uterine size, shape, and consistency include an increase in uterine muscle mass over the months of pregnancy. In response to elevated estrogen and progesterone levels, the cervix and lower uterine muscle lower uterine segments soften, vaginal secretions increase, and vaginal pH is more acidic. pH equals 3.5 to 6.0. Change in vaginal pH discourages the survival and multiplication of bacteria. However, it also encourages infection by Candida albicans. The vagina elongates as the uterus rises in the pelvis. The mucosa thickens with increases in secretions, vascularity, and elasticity. See Chadwick sign, Goodell sign, Hager sign. Breast changes. The breasts become enlarged, tender, and more nodular. The areolae darken. The nipples become more sensitive and erectile, and Montgomery tubercles enlarge. Colostrum may leak out during the last trimester. as the breasts prepare for lactation. Endocrine gland, the size and activity of the thyroid gland increases markedly. Thyroid binding globulin and triiodothyronine levels rise, while thyroid stimulating hormone levels drop slightly. These changes allow the pregnant woman to meet the endocrine needs imposed by the developing fetus and other body changes that occur during pregnancy. Pituitary activity increases. Placement hormones prevent ovulation and encourage development of the corpus luteum. Cardiovascular alteration, circulation, blood volume increases progressively throughout pregnancy, peaking in the middle of the third trimester. Although the red blood cell count rises by about 30% to 30%, the 50% increase in blood volume creates a false impression of anemia. Rising level of clotting factors 7, 8, 9, and 10 increase coagulability. The pulse rate increases along with the cardiac stroke volume. Mid-trimester blood pressure may be slightly lower than normal but remains essentially unchanged. Skeletal system. Softening and increased mobility of the pelvic articulations is reflected in the waddling gait of pregnancy. As pregnancy progresses, the woman's center of gravity shifts and the lumbar curve increases to compensate for the growing anterior weight of the gravid uterus. Problems with dental caries may become more prominent during pregnancy, but can be prevented with oral rinses such as chlorhexidine and regular brushing and flossing. Respiratory system. The effects of progesterone on smooth muscle include a decreased airway resistance, which enables the woman to meet her increased needs for oxygen by permitting a 30% to 40% increase in tidal volume and a 15% to 20% rise in oxygen assumption. The effects of estrogen include edema and congestion of the nasal mucosa, reflected in nosebleeds and nasal stuffiness. Gastrointestinal system. Nausea and vomiting is the single most common complaint during the first trimester. Progesterone-related diminished motility contributes to some complaints of heartburn and constipation. Skin. Pigmentation changes in pregnancy include chloasma, the so-called mask of pregnancy, areolar darkening, and linea nigra, a pigmented line that vertically bisects the abdomen. They reflect estrogen-related stimulation of skin melanocytes. Urinary system. By middle of the first trimester, the glomerular filtration rate (GFR) has risen by about 50%. In compensation, tubular reabsorption also increases. Although urinary frequency is common, In the first and last trimester, bladder capacity actually increases. However, pressure from the growing uterus reduces the volume required to stimulate voiding. During the second trimester, the uterus rises out of the pelvis, becoming an abdominal organ and relieving bladder compression. Weight. In average-sized individuals, expected expected first trimester weight gain is 2 to 5 pounds. Total weight gain and the pattern by which it increased should be monitored by enable earlier signs of pregnancy-related problems common to the particular point in gestation. The Institute of Medicine recommends the following weight gains during singleton pregnancies. A woman with a pre-pregnancy body mass index less than 19.8 should gain 25 to 39 pounds, 11.4 to 17.77 kilogram. A woman with pre-pregnancy body mass index from 19.8 to 26 should gain 25 to 34 pounds, 11.4 to 15.5 kilogram. And a woman with pre-pregnancy body mass index from 26 to 29 should gain 15 to 24 pounds, 6.8 to 10.9 kilogram. The recommended weight gain during pregnancies are different from the multiple gestations. Example: a woman carrying triplets should gain about 50 pounds, 22.7 during the course of her pregnancy.